Hey everyone, so this is going to be our last video on the topic of anaphylaxis, okay? And we are going to talk specifically about treatment options. So what you might need to do for a loved one or for yourself or even for a complete stranger. And then at the end we're also going to talk about some prevention methods. Okay, 1. Signs and symptoms. So we need to know that someone is suffering from anaphylaxis before we start treating them for anaphylaxis. So what are we looking for? Hives and itching and swelling and difficulty breathing, gastrointestinal discomfort. Okay, we're looking for all of these factors or a subset of these factors to indicate that this person is suffering from anaphylaxis. So we determined that anaphylaxis is onset. So what do we do next? We give medications. So let's say that you're allergic to peanuts and you have part of a cookie that is made with flour that was processed in a factory that may contain peanuts. So there's just a little bit of peanut protein in there and it causes your lips to swell a little bit and get a little red and you just kind of feel a little achy in the stomach. So what people might do is take an antihistamine, which we know from our other videos that histamine and other inflammatory agents is what actually makes the anaphylactic response happen. So if you can negate the effect of the histamine, you can bring down the symptoms. So let's say that instead of eating just a cookie that was made with flour that had a little bit of peanut in it, you just eat a peanut butter cookie because you know you're allergic to it, but you have no idea what it tastes like. So you just eat it thinking, this is the best cookie I've ever had. So what you're probably going to have to do is give yourself an EpiPen. An EpiPen contains a dose of epinephrine, which is also known as adrenaline, okay? So an EpiPen kind of looks like a big marker. Okay, it's got a little plunger here. All right, and you have to get prescribed EpiPen. You can't just go pick one up. Okay, so here's an EpiPen, and let's say this, someone's leg, they have no knee. So what you do with an EpiPen, take off the safety cap, and then you inject it into your leg above the knee, okay, so into the quad, one of the big muscles that has a lot of vasculature, so that you can get it into the blood supply quickly, okay. So one thing that you should know is that epinephrine is a pretty serious drug, and when you take it, you're going to have some effects. You're going to be able to breathe a little more easily, and your blood pressure is going to come back up, which is good. The side effect is you might tremble. So if you've ever been scared by a friend, you might have been scared so badly that you start to shake. That's the adrenaline working. So you might start shaking if you give yourself an EpiPen. It's completely normal. You might also feel anxious, also completely normal. That's telling you that the epinephrine is doing what it's supposed to. Now, a couple things about administering epinephrine. 1, it's okay to take more than one. To take. Okay? So that's kind of the deal. Some people think that you can only give yourself one EpiPen. Not true. You can give yourself as many as you need up to a point. So say you give yourself one, you wait 5 or 10 minutes, nothing's happening. You can give yourself another, because the idea with the EpiPen is that it's a therapeutic dose of epinephrine that's just enough to give you some time to fend off the anaphylaxis, but it's not as much as you would be given, say, if you show up in the hospital. They're going to give you a different dosage. Okay, this is really to provide first-line defense against anaphylaxis, but you can take more than one. Okay, the second thing is with a set of medications called a beta blocker, there can be some complications. Okay, so beta blocker. So a beta blocker is used to treat elevated blood pressure, we'll say HBP for high blood pressure, and other cardiac illness like arrhythmia. Okay. So this is how a beta blocker works. There's a little receptor that responds to epinephrine. And when epinephrine gets into that receptor, it does all the things that epinephrine does. It causes your blood vessels to constrict. It makes them less leaky, right? So in a person suffering from anaphylaxis, we want that to happen. However, if you're taking a beta blocker, this is what happens. The beta blocker is an antagonist to this epinephrine receptor, meaning it just stays in the receptor and gets in the way from epinephrine binding to that receptor. And if you have high blood pressure, that's good. We just said everything that epinephrine does. It increases blood pressure. And if you have high blood pressure and you want to keep epinephrine from doing what it does, you use a beta blocker. It works great. But if you're having an anaphylactic response, you need epinephrine to get in there. So in this case, an EpiPen is not going to work very well. So if you're susceptible to anaphylaxis but also have high blood pressure and you're taking a beta blocker, you might want to consider switching to something called a calcium channel blocker. I mean, this is just one option and certainly something you should consult a medical professional before doing. Calcium channel blocker will bring down blood pressure, but it uses a different mechanism. Okay, so this is something to be aware of. This is a complication that could be very dangerous if you're susceptible to anaphylaxis. Okay, so let's go over here and talk about what will happen if you end up going to the hospital. Okay, you have a serious reaction. Okay, so the things that we need to worry about. One is resuscitation. So it can happen that if your reaction is severe enough, your heart might stop beating, you might stop breathing, you might have to be resuscitated. So something to be on the lookout for if you spend a lot of time with someone that is susceptible to anaphylaxis. It's good to know how to provide resuscitation. So the next thing that might happen is what's called intubation, which is basically where they put a artificial windpipe down into your lungs so that you can get oxygen into the blood. Okay, so oxygen comes along with intubation. So that's to help you breathe, because remember, the windpipe somewhat collapses under the constriction of the smooth muscle that surrounds it when you have an anaphylactic response. So we need to get oxygen into the lungs. Okay, last thing, IV fluids. Your fluids are going to be low because all of the cardiovascular components, the immune cells, a lot of the water, they're going to move into the tissues. So the immune components are going to move into the tissue, and by osmosis, a lot of the water is too. So your blood pressure is going to drop. So if you can put IV into the veins, then you can bring the blood pressure back up and restore some of those fluids. Okay. All right. Another interesting aspect of anaphylaxis is what's called biphasic anaphylaxis. And it's exactly what it sounds like. So what this means is you can have a secondary reaction 1 to 72 hours after your first response. So, you go to the hospital for anaphylaxis, you're there for a little bit, you really just want to go home, chill out, watch some TV in bed, and everyone's saying you need to stay here to be observed for a little while. Well, this is why. You could have a secondary reaction that needs to be handled by medical care professionals in a timely manner. So this is something to be on the lookout for if you have an anaphylactic response. It's pretty serious. So, last thing, we're just going to talk about preventative measures real fast. So we've mentioned a couple in previous videos. One, get allergy tested. So go and see what you're susceptible to. Another thing you can do is carry your EpiPen, carry your medications with you all of the time. Another thing that people do is wear a medical response bracelet. So if you're having an anaphylactic response somewhere and you don't know anyone, no one knows that you're allergic to something, they can look on your bracelet and know to call for help. Last thing, kind of an interesting side note, is something called immunotherapy, which is where they give you small doses of the thing you're allergic to so as to build up your resistance. So there are some allergens where this is a good way to build up your resistance. And if this is something that you can do that's available to you, you might consider it. Okay, so that's an overview of anaphylaxis and the treatments thereof. I hope you found this helpful. Thank you.